He is also a resident epidemiologist for our experts in NITAG and TAG at magbabahagi po siya ngayon ng mga basihan at pag-aaral kung sino-sino po yung dapat na priorities natin for those individuals with comorbidities ngayong magkakaroon na tayo ng simultaneous vaccinations from sectors A1 to A3. So, Dr. Wong, you have the floor, please.
Thank you, Yusek. Nikki, may I have my slides? Thank you. So I'll just give a short presentation on the risks of elderly and persons with comorbidities if they get COVID, no? And then we can field questions afterwards. Next slide. So let's talk about the elderly first. No? So why are they considered A2, no, or second in priority after health workers? No? This is based on our data, no, in 2020. We found that the elderly are 15% less likely to be infected, no, and this is probably because they have been asked to quarantine, no, or to shelter in place, no, during our lockdown last year, no. However, if they get infected, no, they're 5 times more likely to get severe disease and 10 times more likely to die. No, that's why it's very important to vaccinate them as soon as possible, no, to prevent these hospitalizations and deaths. Next slide. And then we have these 7 pre-existing illnesses or comorbidities, no, that also increase a person's risk for hospitalization or death if they're infected with COVID. No? So, for example, if you look at chronic respiratory disease, no, the first disease, no, these patients are at 4 times the risk of 4 times more likely to get severe disease when infected, about 3 times more likely to be admitted to an ICU, 4 times more likely to die, and overall, their risk is 3.5 times, no, to get an adverse outcome, no, and you can see the same data, no, for all the other diseases, no, hypertension, cardiovascular disease, chronic kidney disease, malignancies, diabetes mellitus, and even obesity. Chronic liver disease was studied, no, but since there weren't enough patients in the sample size, no, the results were not significant. So these are the 7 diseases that were prioritized, no, to be belonging to A3. Next slide. The elderly also have comorbidities, no, but since they're already in A2, if we exclude the elderly comorbidities, no, among non-elderly adult Filipinos, no, about 14.5 million of them have underlying conditions. No? So that means about 25% of non-elderly adult Filipinos have underlying conditions. About 21% or 12.1 million of them have one underlying condition, and 4.2% or 2.4 million of them have at least 2 underlying conditions. No? So we have quite a large percentage of non-elderly adult Filipinos who have comorbidities. Next slide, please. So this is just the same data, no, in table form. And so after the elderly, no, this is the next group that we have to protect, no, from adverse outcomes of COVID, no, because of the current scarcity of vaccines. I think that's my last slide. Thank you.
Thank you, Dr. Wong. Well, we're still waiting for questions from our video partners that are related to the topic po, no? I would just like to clarify po, what is the narrative, or what is the key message that we would like to emphasize with the data that you have just presented po? Dr. John?
What we want to emphasize is that because of the current scarcity of vaccines, we have to prioritize those at highest risk for hospitalizations and deaths. So after health workers, these are the two groups of Filipinos who need to be protected next. And all of this is based on scientific studies.
From Caroline Bongkin po, she's asking, tama po ba na yung mga comorbidity kanina ang priority for vaccination?
Come again, Nikki, I didn't hear the first part of the
Tama po ba na yung mga comorbidity kanina ang priority for vaccination?
Yes. So their third priority after the elderly, because the elderly have higher risk compared to persons with comorbidities. So the third priority are non-elderly adult Filipinos with comorbidities.
From Sophia Toma Cruz of Rappler, just to get a better understanding of non-elderly with underlying conditions for registration purposes, what are these po? How might Filipinos know if they have underlying conditions that qualify for A3? Doc John, or perhaps you Secret as well. Go ahead po, Doc John.
So of these 14.5 million Filipinos, some of them probably will already have been diagnosed. So if they have a previous diagnosis, they have a medical certificate, or they have a prescription, they can use that to register as a A3 group. For those who have not seen a doctor, it might be a good time to see a doctor, to see whether they have any comorbidities that need to be treated, that need to be managed to prevent risk from COVID.
Thank you, sir. From Fred Mendoza po, ano po ang considered as comorbidities? Included po ba dito ang depression? And as well as from to you, Secret po, if you can add.
Although depression is a comorbidity or pre-existing illness, it hasn't been found through studies that depression increases the risk of severe disease, ICU admission, or death once they are infected by COVID. So they're presently not included in the A3 group of diseases.
Nick, if I may just add.
Go ahead, ma'am.
Yes, tama po yung sinasabi ni Dr. Wong, So katulad po ng ginagawa natin since we started vaccination, because of the scarcity of resources, alam po natin hindi naman siya sufficient to cover most of this priority sector of the population. Kaya po tayo nagkaroon ng sub-prioritization within this sector of individuals with comorbidity. So, naiintindihan po natin na marami talagang sakit ang saklaw ng mga taong may comorbidities at kasama na dyan ang depression. And we recognize po yung value ng mental health, and it's really part of what we do in DOH to address this. Pero ang ginagawa po natin ngayon are all science-based and evidence-based so that we can rationally allocate these vaccines. So sa ngayon pong hindi pa huusto ang ating bakuna para sa lahat, atin pong ipapatupad itong sub-prioritization kung saan ito pong mga sakit na ipinakita ni Dr. Wong na may mga basihan tayo base sa mga pag-aaral dito sa outcomes ng COVID-19, sila muna po ang uunahin natin. At pagkatapos, pag sufficient na po ang doses natin, yun pong mga individuals na may comorbidities na hindi po kasama dyan, ay babakunahan din naman po natin.
There's a clarification from Jenny Lee Ravelo. The data showing risk of COVID outcomes for elderly, is that based on data from across the Philippines or only in NCR po?
This is for the whole Philippines, from our accumulated data last year.
Thank you, Dr. Chan. From Sheila po, How do you choose those who will be included in the A3? I think Rosette can also add to this. What are the qualifications or characteristics po?
So if they have any of the 7 diseases, no, they can register for A3, and they can show proof by medical certificate from their attending physician or a prescription, no, a recent prescription that they're on medication.
Yes, and just to add to that, Nick, we will be issuing these protocols. Yun pong sinabi ni Dr. Wong, yun po talaga. Pagdating nyo dun sa vaccination site, you can either present a medical certificate or a diagnosis like medical abstract na galing sa ospital kung kayo ay na-ospital dahil dito. Pangalawa, maaari rin yung prescription ng inyong doktor within the last 6 months. So ito po yung ating ire-require. Pwede ka rin magbigay ng parang mga surgical or reports or pathology reports or laboratory results. Lahat po ito ay i-evaluate din at i-assess ng ating vaccination sites. Kailangan po natin maintindihan, ang bibigyan po natin ng bakuna ay yung mga taong may controlled na comorbidity. So, ibig sabihin, kung may high blood po kayo, tapos hindi po controlled yung high blood nyo, and during the time that you were assessed, mataas siguro ang blood pressure, hindi nakakainom ng matagal pa sa kanyang gamot, ima-manage muna po yon bago siya mabakunahan. So, lahat po ng mga requirements na ito ay nakasaad doon sa ating protocol na ilalabas at bibigyan din pong guidance ang ating mga bakunahan na sites natin.
From Red as well as from Sophia, they're asking po if obesity as well as hypertension are included in the comorbidities, and if they could get a list perhaps of these comorbidities and its prioritization in A3 po.
Yeah, the list is on the slides. I think Nikki, you'll give them a copy.
Yes, Doc. Just like Rosette, if you would like to add po.
Yes, we are finalizing our protocol para maipalabas natin ngayong araw na to. So yung listahan din ni Dr. Wong, isasama natin yan dun sa ating protocol. Now about obesity, maybe Dr. Wong can provide us with additional inputs if there are really studies pointing to obesity as one of the factors which has poor outcomes when it comes to COVID-19.
Yeah, so the slide that I present, all the figures from the slide that I presented a while ago came from a meta-analysis. No? So a meta-analysis is a study of studies, no? Meaning they summarize the data from hundreds of other studies, no? To come up with these estimates. No? So these are the best estimates so far of the risk of disease and death, no? For these diseases. No? So, for example, for obesity, this is usually diagnosed or measured, no, in terms of the ratio of your weight, no, to the square of your height. No? So this can be diagnosed by a physician. No? And if your BMI or basal metabolic index is above 30, no, that qualifies as obesity.
Thank you, Dr. John. From Christine of ABS-CBN, may sub-prioritization po ba within the comorbidities group? For example, those with 2 comorbidities, mauuna po ba muna sila? Are the comorbidities ranked based on sino po ang mauuna? Dr. John?
As far as I know, although Secretary said can correct me, as long as you have any of the 7 comorbidities, no, you can go for vaccination. No? It would be too much of a logistical burden, no, if we have to do it comorbidity by comorbidity.
Tama yung sinabi ni Dr. Wong, Nick, Christine. Yung sub-prioritization natin would just include the list of those diseases na meron tayong scientific basis of poor outcomes. Yun po yung ating means of sub-prioritizing. But for those na pagkatapos nun, yung kung sino may isa, may dalawa, may tatlo, hindi na po natin gagawin yon. Basta sila po ay kasama dun sa 7 sakit na yan, sila po ay mabibigyan na ng bakuna pauna sa iba.
From Caroline Monkey of and Medical certificate po ay kailan dapat issued as well as yung protocol daw po kung kailan ilalabas. Yung SEC.
Nasagot natin kanina yan, ano? So sabi natin, the protocol will be issued within the day. Ayun pong medical certificate ang napagkasunduan po ng ating mga experts together with Dr. John sa NITAG and TAG for the past 18 months, yung ating medical certificate. Kasi naintindihan po natin na ang ating mga kababayan maaring hindi na nakapagpa-check up mula nung nag-umpisa yung pandemya. For the prescription, we will accept within the last 6 months.
Thank you, Sec. From Donna Pasibugan, Doc John, ang slide po shows 8 comorbidities. Is it 8 po or 7? Just a clarification perhaps po, Doc John.
It's 7 of the diseases. No, we're very sure na it causes adverse outcomes. No, the 8th one, chronic liver disease. No, since there were too few subjects in the sample in the study, we're not that sure yet. No, whether they cause adverse outcomes. No, so this is for NITAG and TAG to decide on.
No more questions from my media partners. Doc John, would you like to give a brief message before we proceed with the other DOH questions? Thank you, Doc John.
Thank you.
A final message, Doc, that you would like to emphasize before we proceed.
Okay. So with regards to the comorbidities, no, and the surge, no, I want to tell the public that if you have any of these comorbidities, and these are quite a large number of Filipinos, no, 14.5 million Filipinos who have this, no, you have to be very careful, no, going about your daily lives, no. Observe the health and safety protocols, no, and if you have symptoms, no, especially if you have a comorbidity, no, consult right away, no, don't wait too long, no, within 24 hours, you should seek medical treatment, no, and get yourself tested, no. This is the only way that we can identify those who are infectious, no, and isolate and quarantine them so that we can reduce the number of cases, no, and terminate this surge.